In order for a population to access care and the care that they need, there has to be an underlying level of trust. And so we start first with building trust. We build relationships. You mentioned seeing me in the community. I want to be able to connect with patients so that they know I am you, you are me.
Absolutely. Absolutely.
Right?
Yeah, absolutely.
I am you, you are me. You are my grandmother, you are my aunt, you are my great grandparents, right? It's the connection. It's giving them a point of reference for trust.
My name is Tiffany Whitlow, and this is Now Included Unfiltered. My name is Tiffany Whitlow, and this is Now Included Unfiltered. On today's episode, I have the privilege of sitting down and hearing from Michelda Johnson, who currently serves as the CEO of HAPPI Health. Welcome, Michelda.
Thank you so much. It's an honor to be here.
I am truly humbled. I follow you on social media. I know you're always out and about. You're taking care of the grand. You're out at some local community event. I've heard you speak as a motivational speaker before. And so I'm so excited for our guests and our audience and our viewers and our listeners to have an opportunity to hear from you. I'll start at the top with, what are you doing today? Today you have the privilege of serving as CEO at HAPPI Health. Unfold that a little bit for us.
Wow, what a journey. I've been with HAPPI Health now for 16 months, and it really started as an interim assignment. The organization needed help, they needed support, and they frankly needed a turnaround. And so I was asked to be the CEO for 90 days and 90 days only.
That's a long 90 days, ma'am.
That's a long 90 days. And so here we are, 16 months later. We have grown the organization by about $1.7 million.
Wow, yay!
We have added 2 new locations, so now we are up to 6 locations, about to open our 7th.
Wow.
We've added a new pharmacy and in the middle of construction for our 2nd pharmacy. The expansion has been real. And here's the best part about it, right? We've grown from serving 10,000 unique patients to well over 12,000 patients in the Madison and Morgan County area, with almost 38,000 visits. So that means for me, with all of the growth,
those patients are coming back.
they're coming back,
Yeah.
right? And with all of the growth, we get an opportunity to see more patients. We get an opportunity expansion. I read a study before I started on this journey, and the study said, because for me, I thought, we're in a really rich county, right? In comparison with the state. And is there really a need for health equity in comparison with the rest of the state? And I read a survey that said that with the existing community health centers, we're still only serving about 16% of the population that needs care and access to health care. Wow, was what I said. And so the expansion means that we can continue to pour back into the community, add additional services, see more patients, and make sure that we are accessible and in the places where our patients need us. So HAPPI has been wonderful in that regard.
I love that. And you touched on something where you talked about healthcare being needed by individuals. Do you believe healthcare is going to be more predictive, more personalized? And so what does that look like for HAPPI Health? Are you guys investing in that area? Are you looking for partnerships? Is that even something that your patient base is asking you for?
It is, right? And so a part of what is important to me is really transitioning even the perception of community healthcare. When we look at, Tuskegee, right? It didn't just happen, it was a trend. And so, in order for a population to access care and the care that they need, there has to be an underlying level of trust. And so, we start first with building trust. We build relationships. You mentioned seeing me in the community. I want to be able to connect with patients so that they know I am you, you are me.
Absolutely. Absolutely.
Right?
Yeah,
I
absolutely.
am you, you are me. You are my grandmother, you are my aunt, you are my great grandparents, right? And so it's the connection. It's giving them a point of reference for trust. And then when you build in the trust, absolutely, we are a technology center. We want to be a place where we are open to the latest in whatever that is, whether it's biologics or whatever is moving and helping move the needle in the comorbidities that we see, especially in the Black and Brown community. We have to be open to that. We have to be accessible to that. I am open to clinical research. I think it's important that research happens. It's the building blocks, though, of trust that have to go along with
Yeah.
it for the community, especially the underserved community, to want to participate, right? And so I think, that's something that we've looked at and we've discussed at HAPPI is how do we open that door? And we're certainly open to exploring that because we do have, well over 12,000 patients who trust us and trust the advice that we give. And so I think it's a conversation that is definitely worth exploring.
Yeah, absolutely. I think it goes aligned with everything you've said about just making healthcare and the future of healthcare accessible. And in this respect, you have a pharmacy there. You want to make sure that there's greater representation in the development of those therapeutics. So.
Absolutely.
But LabCorp actually made an investment in our company. And through that, we have a new opportunity where we're doing some at-home testing. So we're offering at-home testing. And instead of us getting a kickback, we have that set aside for us to give free tests out to people. So HAPPI, we definitely need to collaborate on what that looks like. But there's a long laundry list, really, of all of the various tests that are out there. And it's really just for people on that preventative scale to know what they are at risk of. And so happy to collaborate in the future on making sure that your patients have the opportunity to participate in something like that. And then just overall, I think healthcare only matters for people when they're actually sick. Right. And I think we are all collectively doing this hard work to kind of swing the pendulum the other way where, no, you actually need to be thinking about your health when you already feel good.
Exactly.
Right. And so it's like when you feel good, how can you sustain that feeling good? How can you eat better foods? How can you prioritize your health? How can you make sure you get to the dentist every 6 months and all of those various trigger points? And so kudos to you for not only making healthcare accessible and putting it in physically in communities where people are, but then making sure that even if you can't afford it, we still have something here for you and then doing it with care. I know for myself, I was a young mom. I had my oldest son, got pregnant at 19. Had him at 20 and I was on Medicaid and he was on WIC. And it's funny to see me now as a co-founder and chief development officer. I remember what life was like going through those years and even going to the local office, the WIC office, and feeling less than. I walked in the door and I felt less than. I felt like, man, all I want to do is work so hard that I never have to come back in this place in this capacity again because I felt bad. I felt icky. And so that really stood out to me that you're like, no, I want to make sure our patients feel equal and feel like they matter even when they don't have a penny to feel like they matter in the same capacity. Sometimes it's not their fault. And sometimes people are working to get to a better place in life.
Listen, our patients are not a burden. And so that's what we have to remove is the stigma that that whatever they walk in that door with, that it's a burden to us to provide the level of care that they deserve. It's not a burden. We see patients from all walks of life. We see patients that have just had hard times. We see patients that can't get it together, and that's okay, right? They still need the compassion, the care, the community, right? They still need to know that their provider is going to be concerned about them. And I am just so blessed. Our Chief Medical Officer, Dr. Kyle, faithfully served U.S. Army, retired from U.S. Army, a family physician, family provider, and said, I have to give back. And so he gives back in a way that is, it's so heartwarming to see the contact that he has with our patients. And because we take walk-ins, we don't care. If you got an appointment, great. If you don't have an appointment, great. If you have insurance, great. If you don't have insurance, no problem. We really take, and we really work hard to take the stigma away from, I'm at a community health center. And I love it because 20%, 30% of our patient base are TRICARE and Blue Cross Blue Shield and United Healthcare.
And so you really are blending them there.
We are, absolutely. Absolutely. There is no stigma. There is, again, state of the art. We want to make sure we've got the latest in technology. In fact, one of my vendors, he joked and he said, you guys have the Rolls Royce technology that you use sometimes like a broke down Toyota. I said, well, we're going to fix that, sir. Because we buy and we have, and it's so that we are giving quality care. We have LabCorp phlebotomists on site at every single clinic so that we can make sure they're getting the best of the best. And I want to continue to do that. What's important to note, though, is that we are a look-alike. So we're federally qualified health center. The misnomer is that we only see pediatric patients. Not true. We see from womb to tomb and all in the middle. And so, but we're federally qualified health center, community health center. We see all patients, but we do not receive federal funding.
Oh.
And so
Intentionally?
There's a grant process.
Okay.
And you have to apply for the grant process.
Yeah.
And they only give a certain number per community. And we were close. And then when the new administration came in, they deleted or paused is the correct word. They paused the grant that we feel like we would have received.
Okay.
And so we've been in talks, and hopefully they're in the process of unpausing that opportunity.
You have an opportunity for that additional funding. Okay.
Yep.
Okay. So, I mean, I feel the energy that comes from just talking to you, and I can imagine what it's like working for you. So says the team. What are you really saying to empower a mother who walks in the door and feels like she just can't prioritize her own health, but she's there to take care of maybe her little child?
So we did something, it's been 7-8 months ago, called a patient advocacy team, a patient advocate team. And we put in place this team of folks who will literally take the patient by the hand and walk them through what they need.
Okay.
This team will, from coordinating appointments, we have individuals who can't physically get to our location. We provide bus tickets, we provide food vouchers. I'll send an Uber to pick up a patient, like whatever it takes. And so this patient advocacy team, their goal is to make the patient feel comfortable in our setting.
Okay.
We have a kiosk system where they check in. Someone is standing there with them to help them check in.
Okay.
Someone is talking to them to find out, ask all the questions to make sure they're prepared for the care that they are seeking. And for us, it's not just take a number and go sit down, right? It's how can we provide really hands-on white glove service
and experience,
right, to individuals that may not feel comfortable, are not sure what to expect. And I think that is why we've been able to grow tremendously. We've had in the last year and a half, 10 to 12% growth, which is somewhat unheard of in the community health center environment. But it's because of, I think, our approach and the patient advocacy team that we have in place. We even have mothers who come in, and all of our staff, or I should say at every clinic, we have bilingual staff. So that we can serve all populations. And so we make sure that there is advocacy available, that there are resources available, and that there is someone who can communicate and connect with patients as they walk in the door.
Are you seeing that the majority of your patients really truly understand technology and are utilizing technology? Do you think they're early adopters? Like where are they at?
From a technology standpoint, I would say more than half
Okay.
understand technology. We did a campaign several months ago on portal access and making sure patients had portal access
Does
so
that
that they
require
could.
Wi-Fi?
It does.
Okay.
So that they could communicate with their provider. And there were some gaps in that, and we noticed some of those gaps, as you've noted, because of Wi-Fi access. We make sure communication is in all languages, so we translate it in the language that's
Wow.
appropriate for our patient. But we do see, especially when we rolled out the kiosk system, we saw a little bit of hesitancy. We saw some that would check in online because they loved it, and
Yeah.
then some that would not. And so I think they are slowly embracing the technology that we have and really making it a part of their everyday life.
Yeah, that's kind of what we see when we go into a community and we do community engagement events. I have team members that are like, "Oh, we're gonna scan the QR code. We're gonna use the QR code." And I'm like, "Listen, people are so over QR codes that the majority of people actually will scan it. They'll open it on their phone, they will start it, or they'll look like they'll start it, and they will not finish." So the incompletion rate is just so high on people not being able to go all the way through. Then you have people like my grandmother who are aware of technology, but don't use it at all. So we still go into community with paper surveys
Have to.
often.
You have to.
And so so that's our version of, really meeting people where they are and having something for everybody, because we understand that there's some people who I personally rather stand there and have to fill it out and talk to you while I'm doing it versus be on my phone and just because I'm always on my phone.
Yeah.
So I don't need to be on my phone now. And so, I mean, this sounds crazy, but like even being in community, just sitting here and talking to you, or like
Yes.
sitting there and filling it out.
Yes.
So I think sometimes we try to shortcut in areas where we can't. It doesn't sound like that's happening at all at HAPPI.
No, because we want to, the key thing though that we have to manage is we see close to 1,000 patients a week.
Wow.
It's a lot. Our
Wow.
volume is really high.
Wow.
And
And what are the hours?
8 to 5,
Wow.
Monday through Thursday. We have one clinic, our Sparkman Drive clinic, that is 8 to 8 on Thursdays. And then Friday, we're only open until noon. Our urgent care is open 6 days a week. So we have an urgent care facility as well. So in the process of making sure we are getting the volume through, we have an internal goal that our wait time or our patients in clinic time has to be 60 minutes or less. We want a patient processed
In and out.
through, in and out, in really 60 minutes. That's doable. And so we use the technology though to really, we are measuring things like how long does it take the provider to get into the room?
Okay.
How long did the patient sit in the waiting area before they were roomed? And we analyze that clinic by clinic, provider by provider. And we're always looking. In fact, we've got our quarterly strategic planning meeting next week.
Yeah.
And so we'll go through the areas where we've missed the mark on the 60 minutes and why. And what I found is the thing with a community health center is a sense of, and this is a culture shift that I made with our staff. The culture shift was, well, be grateful that we're here to serve you. And I had to tell our staff, you be grateful that they show up at our door, because without them, we would not exist, right? And so the gratefulness is not, they should be grateful for us. We should actually be grateful that we get the opportunity to provide
And
the
serve them.
services that we provide and serve them in such a way that really, I mean, think about this. If I don't have proper health care, I can't work. I'm not going to school. I can't be a contributor to society in the way that I'm supposed to be if I'm dealing with heart issues, diabetes, high cholesterol.
Yeah.
We provide behavioral health and counseling. So we see kids that have ADHD or have been diagnosed. So what happens is the school system may say, this is a problem child. And we come back and do through assessment say, no, no, no. Little Joe is okay. Little Joe just needs a little help because Joe is dealing with a lot at home.
Yeah.
Joe is battling through issues with mom and dad, or mom and dad not being together, or grandparents. And so we have to help bring that balance to the conversation. But if Joe doesn't go to school, Joe can't get the education that he needs. So we have a counselor that manages and counsels our patients from schizophrenia to anxiety to depression. We have patients who walk in the door and they are being assessed for a medical condition. And in the course of providers completing PHQ-9s and all the things, they find out this person is suicidal. And so we partner in the community to make sure that we're getting, our counselors are involved, our behavioral health specialists get involved. It becomes a lot.
Wow.
And so a part of that is managing the core realities of a patient who really doesn't have the financial resources to get what they need, thus the pharmacy, right? So I can see you and now I want to treat your high blood pressure, your diabetes or whatever, but you can't afford to go purchase your insulin. Well, guess what? I got an answer for that. You go to HAPPI RX. We'll take care of you. And that's what we do, right?
Wow.
You have some kids who are having tooth pain and toothache. And what we found is that there's a limited number of dentists who will accept Medicaid. I got an answer for that. Give me to the third, fourth quarter of this year, right? That's what you got to do.
Yes. Yes. Meet the people where they are and supply them with something that is valuable and needed. And it sounds like that is what you're doing. I mean, it's not only just access by physical location, it's access by come to this location and have multiple offerings, and we have a little bit of everything that you need, whether it is dentistry, pharmacy, behavioral health services. And so I love that you're all about the whole health,
the whole body.
We are meeting with subject matter experts around the country all the time who are talking about clinical research and being able to offer the advancements of medicine. And, you know, I like to say, like, you can't go into a community and ask people to participate in clinical research. I'm not even a clinical research advocate. I believe everyone should be afforded equal education and access to have an opportunity to say yes or no. What's happening today is we're not asking folks because you think they're going to say no.
Yes.
And then when you are asking people, they are saying no because they don't have proper education. And so that's why we even shifted our mission to say we want to empower 1 million people to take actions towards better health, because that action might look like you going to see a behavioral health doctor for the first time ever, and little Joe going to the dentist after all of that care, right? And so that action looks different for everyone. But imagine if so many people, 1 million people, were taking those actions, 1 foot, 2nd foot, just every single step really means a changed life. And we all know, especially with the power of social media, that change in life nowadays can go viral.
It can. It can.
And that virality that comes behind that is more people changing. And so this is why I wanted you here. I wanted people to hear, like, in your local community, there are Black women who are resilient and changing the game and changing the look and the feel behind healthcare. And so it doesn't have to be care that's only there when you're unhealthy. It's care for you and your whole family and your whole body all at one time. And I think that is just really what has been missing for a really, really, really long time in healthcare. This podcast is brought to you by Acclinate's Now Included Community.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you and find a safe place for your story. Walk into a space where being you is celebrated and find your power. Your health, your story, your power.
I want to kind of pivot a little bit. I know you've had a non-linear path like we all have. And one of the hats I know you have worn is a motivational speaker. And I bet it's really hard to kind of turn that off. But I've heard you empower people. And so how are you truly empowering someone who's listening to this right now and says, I'm too busy to prioritize myself? And this person could be in their career. This person could have already moved up the chain and is retired. But I think we've all gone through this period where we have forgotten how to prioritize ourselves. How are you empowering that person?
First, I have to take a deep sigh because you're right. We get so busy. Personal story, right? I had such an interesting challenge. It almost knocked me off my game a little bit, right? I needed to take custody of my 6-year-old, at the time 5-year-old granddaughter. And so here I am 55, and I'm thinking, okay, I am ready to retire. I am in chill mode. I'm in travel mode. I hope I can say this. I'm in, full-blown menopause.
Yeah, you can say it.
And here comes this 5-year-old bundle of joy, and she needs Gigi. And I think the first 6 months I was in denial. Lord, why is this happening to me? And I read this here, execute. That's my love language. And so I knew how to do that. I knew how to pull up the bootstraps, never let them see you sweat. You move through, you make things happen. I know how to do that. But what I realized that I needed to learn how to do now was to learn how to be in alignment. And with alignment comes the power of the word no.
Oh.
Okay. So now as I'm aligned, I realize there are things that I say yes to because it's what I'm supposed to do. And there are things that are an absolute no. And it's not because of the individual. It's not because the cause is not worthy. It's not because it's not something that I care about. It's because it's not in vertical or horizontal alignment with where my life is in this time, in this season, and in this moment. So we have made, we booked and busy, we bougie and busy, we busy and busy, we busier and busy. We have made that, especially as Black women, a theme. We got to grind and stay at it. We got to da. No, you don't. You got to practice alignment. And when you practice alignment, you give yourself permission to be.
Oh.
And sometimes the reason why we are so busy is because we've become out of tune with our own thoughts and with our own selves. Because if I sit down and really deal with what I'm dealing, I'm not going to like it, because there's going to be something that is required of me that I don't want to. Internally, something that is required that I've got to then take a more introspective look into myself. And as long as I'm busy, I don't have to look within. So what I would say to that individual, to that woman, is take that look within. There's power in looking within because it aligns you to be better for everybody that you're called to serve. Here's the second piece of that. There's a hunger for voices that are authentic and that truly care about community. And most of these women are so busy that their authenticity cannot come through because of the lack of alignment, right? And so what I would encourage them to do is allow yourself to take the step back, to pull back the layers, to understand the power of the word no, and then to realign to what that yes is so that the authenticity of your voice shines through. And it's okay to say no.
I love that. I know that was really for women, but the whole time I could hear this little voice in the back of my head. A mutual friend of ours, Mr. Kenny Anderson, also talks a lot about saying no. And I think about even my own husband, how I have to tell him to slow down, and preventative health is very far from his mind right now.
Yeah.
But winning is all he cares about right now. But the reality,
Winning is good.
Yeah,
Winning is good.
I guess. But the reality is, even men need a message. I mean, in some respects, it's like you can't be the head of the household if you aren't healthy.
Your first ministry is your household.
Oh.
And sometimes we forget that. We let our job and our career and our ego become your first ministry. I was thinking about some things, the mindset of expansion, right? I was thinking through that. And there's two things, right? It's dominion and it's understanding who you are called to be. And if you go back to the beginning of time, God gave Adam what? A garden. That was the first thing he gave him, was a garden. And he said, go make that produce. Go make that. Your family is the garden. Right? He that finds, oh, I'm not going to go there, but your family is your first, right? That's your job is to cultivate. What do you do in a garden? You cultivate it, you nurture it, you till it, you make sure that it has every component necessary to be able to grow. And so many of us are neglecting the garden that we've been given, and that's why we don't necessarily walk in the level of power and dominion that we are supposed to. And so now it's got to be a return to who you were already destined to be, because you've learned to nurture the place where you've been planted.
Yeah, and I don't say it that intensely, but
I'm sorry.
but I appreciate receiving it that way. Because I tell my team members, we have about 71% females on my team, and I all day long to that.
Love it.
And I tell them all the time, I need you to be mom and wife and you before you can be anything for us here.
Yes.
And because we're in community, because the core of our company is community, it is our why, it's our driving force. Because of that, it's always going to be demanding. There is absolutely nothing I could do to not make it demanding. That could be on the .com or that could be in person. And so I need you to find out how you're going to prioritize yourself and how you're going to prioritize your health so that you can be who I really need you to be for our community. And so that's how I say it. I love how you said it. But at the end of the day, the core is the same. Whether you are a man or a woman, it doesn't matter. You have to do it. And it's really at any stage of life. That's why I like constantly talking about it, because I think for my 18-year-old, it looks a certain way. For myself, it looks a certain way. And for my husband, it looks a certain way. And for my grandparents, it looks a certain way. And in the later stages of my family, I see my grandparents really sowing into the other generation ahead of them. But in some families, it actually looks like, especially in more privileged families, it looks like them investing in various peptides and all these biochemical companies so that they can stay. Really, the biohacking is a whole little kind of sub-industry that's forming here, so people can live as long as possible.
I tell my staff, right, please, in fact, please, every quarter, once a month if you need to, I don't care, take a mental health day. We work hard, right? What we do, no federal funding, we're scrapping through sometimes. We work hard. Please, sir, please, ma'am, go take a mental health day. Go take 2 days where you do nothing but work from home. Like, I need you to have that break because I need that break. It calms, it refreshes. You come back empowered.
I agree.
You come back with clearer thoughts. You come back with greater innovation and thoughts about what do we do next. It spurs, I think, strategic thinking and processing and flow. And so, please, you got to take your mental health days.
I love that. I love that. No, I mean, I appreciate you sharing. You've shared so much. I appreciate you sharing the personal stories, because I believe we all connect in ways that we don't really even know until you get to hear someone's personal story. But then also how healthy is an example, and really setting the stage nationally about what can be done here through what's being done here in Huntsville, Morgan County, in this area. I think you're setting the stage for other communities. I'm sure there are other federally qualified healthcare centers that aren't getting the funds that they have once received, and are trying to figure out how to reinvent themselves. And there's pharmaceutical companies and healthcare organizations that are figuring out, like, what does it look like to go into a community and invest? And we're sharing some of those nuggets on what that actually looks like to connect and invest with people. So I appreciate you being here and sharing your story and your why. Is there anything else that you would like to leave the listeners with today?
Listen, if I could leave with anything, it would be make you a priority. Whatever that is, whatever that looks like, make sure you are getting your checkups, that you are, doing the screenings, that you are paying attention to your body, your health, and getting the care that you deserve, right? And doing it and feeling empowered to do that.
I love that. Well, thank you so much. This has been a pleasure. My name is Tiffany Whitlow, and this is Now Included Unfiltered. Thank you for listening to Now Included Unfiltered. If you enjoyed this episode, be sure to give us a follow and leave a 5-star review. We'll see you next week.